My name is Catalina.
My name is Sahir.
My name is Tarun.
My name is Adela.
And today we're going to be talking about diabetes in business.
Our generation is going through one of the most uncertain times that has ever been seen in history. In a time as unprecedented as this, it serves many difficulties. One of the most prominent struggles that our generation is facing is employees do not have proper resources to manage their own health conditions, which is especially vital during a pandemic that does target individuals with underlying health conditions such as diabetes.
To tackle diabetes in the workplace, businesses such as Amazon and the Midwest Business Group on Health have tried a variety of tactics. Primera states that Amazon's Livongo program provides their employees test strips, lancets, and 24-hour support if a reading indicates that a patient might need help. The Midwest Business Group on Health is engaged in diabetes management by advocating for awareness and communication amongst their employees. Multiple companies have attempted to undertake diabetes by implementing or encouraging opportunities to exercise as it can lower blood glucose levels. According to a study done by Berry et al., just 15 minutes of exercise can improve employee efficiency by enhancing cognitive performance. We propose that the solution to this problem should be that businesses ensure that their diabetic employees are further covered by their insurance or healthcare policy. This solution is significant because employees can have some of their suffering alleviated with support from their workplaces. Treating diabetes and its symptoms is expensive. Each year, the cost of diabetes management increases. According to the American Diabetes Association, in 2017, the estimated total economic cost of diagnosed diabetes was $327 billion, a 26% increase from the previous estimate of $245 billion in 2012. By ensuring that their condition is covered, income equality is promoted. To not have to spend a portion of their salary treating their condition, these employees can find comfort in knowing that they won't have to pick between treating diabetes and providing for their families or other necessities. Employers can further fulfill their responsibilities to their employees with our proposal. Employees with diabetes cannot focus on their work if they have to be concerned with medicating their condition. A study done by the Social Market Foundation showed that happy workers are 20% more productive in comparison to unhappy workers. By guaranteeing that their employees are covered, trust is promoted, which in turn sparks a more efficient and capable workforce.
There are multiple ways that our solution can be addressed, specifically on a national level. First, we'd want to have the government get involved with the issue, which allows our solution to be greatly considered among high-level officials. In addition, some hospitals and offices are government-funded, so having our government participate in promoting the solution will allow hospitals and offices to be aware that there's a recurring issue among millions in the corporate world and that we have a solution to this problem. Another way we'd address the problem is by first addressing employees' wages and expenditures. We specifically address the amount employees spend on healthcare and insurance to emphasize the problem and make it clear that our solution must be implemented to make employees feel safer and healthier as they work to support them and their families. By implementing our solution in the workplace, it allows diabetic employees to worry less about their conditions and more on their work, leading to an increase in productivity. If offices increase their productivity, the economy would rise, allowing economic benefits such as better salary, reasonable prices for goods and services, and a better standard of living.
The goal is to ensure that diabetic employees are covered in their employer's health plan. However, with companies already having a tight budget, it may prove difficult for employers to make sure essentials for diabetic employees such as insulin or physician appointments are covered. Even in unprecedented times where employers are having difficulty providing funds to keep their workforce, it may prove to be even more challenging to cover diabetic employees in their health plans since coronavirus has caused businesses to make extensive budget cuts to stay afloat. Another challenge to ensuring that diabetic employees are covered in their employer's health plan is that often workers could feel discriminated against. Employees could be quick to see this change in employer's health plan as a way to discriminate against them because due to these added-on services, they could believe this plan will not accommodate them and is only tailored to special circumstance individuals. When there's a change in health plans that have more health services, it is oftentimes more expensive, and employees could believe that due to the additional expenses of these special circumstance individuals, it may prohibit them from achieving a financial gain in the company.
One solution to help companies plan to make space for diabetic employees is to set up a payroll. Making sure to account for diabetics' resources, companies need to put a payroll system in place, even with it being a necessity to offer a health plan. Another big solution to help companies provide resources as in insulin and physician appointments is to have the government help out. The government can help by offering national coverage for employees where they can provide essentials to diabetic employees, especially since healthcare is not free for everyone. The next potential challenge to overcome is to help the employees feeling discriminated against and not receiving any extra accommodations with these added services. A solution to this is the employer looking into investing in one of several flexible savings accounts. These flexible savings accounts are beneficial as they are offered by the government to facilitate the health needs of employees. These savings accounts can be employer funded where the IRS gets involved in giving a tax break to the employer. On the other hand, the employees benefit from this by utilizing the funding for essentials for diabetics and any and all healthcare needs for others. This will be equally beneficial to the employees as all of them will receive benefits according to their needs. Additionally, this helps the employers' needs as they also do not need to invest in expensive health insurance policy.
Together businesses can work to create a solution.